Fatigue is one of the most Googled symptoms out there, and it's because it affects so many of us. Hi, I'm Dr. Karthik Odeyapan, and there's not a single week that goes by that I do not see a patient that is here for fatigue or is asking about a new product or supplement that promises to bring back more energy. This video will help you understand the root causes of fatigue that do not show up on blood work so that you can confidently understand what your doctor is thinking and how to best partner with them in getting to those root causes. In part one of this topic, we talked about the causes of fatigue that show up on blood work. So if you've not had a chance to check that out, I will link it. Please start there. If you've already had blood work and your doctor thinks that more or less it's normal and there is not a cause that is found, but something still feels off, you are in the right place. So let's talk about the causes of fatigue that are hidden from the blood work. Be sure to stick around till the end because I will also talk about conditions that are unfortunately becoming more common, like long COVID and post-COVID. And I get so many questions in my practice about these conditions. So let's jump right into it. One of the major causes of fatigue is unfortunately the C word, cancer. Cancer can do all sorts of things like suppress appetite, make you lose weight unintentionally, cause low-grade fevers, but sometimes it can also secrete chemicals that cause you to feel drained and fatigued. This is why I always ask my patients to be up to date in terms of their cancer screenings like colonoscopies, mammograms, pap smears, prostate cancer check. It's also very important for you to discuss with your provider your family history of cancers and if you've had any genetic testing, that as well, because that can help determine if you qualify for additional testing. Another major cause of fatigue that is probably underappreciated is sleeping related issues. Now, in the US, we've always prided ourselves in terms of the amount of work that we can do with as less sleep as possible. Growing up, we've always bragged about how little sleep we got, but I think the tide has changed. I think a lot of us are starting to recognize how important sleep is in terms of functioning throughout the day. But even then, there are still many sleep disorders that are under-recognized. The most common one is sleep apnea, when the oxygen levels can dip at night, resulting in unrestorative sleep. This reminds me of one of my patients who had come in for fatigue and a lack of mental clarity, especially in the morning when he was working. We had done a lot of the blood work, but ultimately it turned out that he had sleep apnea. After he was treated for it, most of his issues had gone away. There are also other sleep-related conditions like restless leg syndrome or potentially jet lag related issues, or if you're working in which you have to do night shift work, that switching back and forth from daytime to nighttime can also result in fatigue. So reflect on the quality of your sleep and definitely discuss with your provider whether or not a sleep issue could be causing your fatigue. Another under-recognized cause of fatigue is probably mood or anxiety issues. I'm sure that every primary care doctor has many stories in which they've had people come to them telling them they're tired, but when we dig under the surface, it's because they're actually depressed or they're significantly anxious. The hallmark of clinical depression is not enjoying the things that you once did, not enjoying the hobbies or the things that brought you pleasure before. And anxiety can manifest as not being able to relax or having your mind racing all the time in terms of the bad things that can happen. I'm going to link you to 2 questionnaires. One is a personal health questionnaire, which is 9 questions that can help you reflect on your mood. The other questionnaire is the generalized anxiety disorder questionnaire, which is 7 questions. And these questionnaires can help you reflect internally on whether or not, a mood disturbance or anxiety could be playing a significant role in your fatigue. If you do think this is happening, fill out these questionnaires, and it's actually helpful if you take them to your next appointment with you to discuss it. Very rarely, some medications could be the culprit of fatigue. This is exactly why I have all of my patients put all of their medication bottles into a bag and bring them to the visit, so I can see what exactly they're putting in their mouth. Some allergy medications or heart medications, for example, can certainly cause fatigue. It's very important that you look through with your doctor and review all of the medications that you're taking. Heart, lung, autoimmune, or even neurologic conditions like MS can also cause fatigue. I will say it is relatively uncommon for that to be the only symptom. There's typically other symptoms like shortness of breath or joint swelling that would accompany the fatigue, but it is possible. I've had this one patient that used to travel back and forth from Florida to Colorado, and every time he was in Colorado, he will feel more fatigued. He had really advanced lung disease, and I think what was driving his fatigue is whenever he was in elevation or altitude, his oxygen levels were dropping, and that's probably what was causing his fatigue. One cause of fatigue that has been on the rise in the last couple of years is long COVID or post-COVID syndrome. Unfortunately, I've started to gain experience in seeing patients every week with this condition. The story goes something like this. Doc, 3 to 4 years ago, I had this really bad illness where I had fever, sore throat, cough, and my life has not been the same since then. And they'll either say one of 3 things or a combination of these 3 things. I feel so tired and fatigued that I have to pick and choose the amount of things that I can do in a day. And if I push past my fatigue, I'm just lying in bed all day the next day. Or they might say something like, every time I get up from a seated position, I get dizzy, I find my heart racing, I'm short of breath, I find it hard to exercise. Another thing that I hear is, I'm having these pains throughout my body that doctors have not been able to explain. And these are all manifestations of post-COVID or long COVID syndrome. I will definitely make a future video about this, but this is definitely a growing cause of fatigue that I'm seeing. So there you have it, the major causes of fatigue that are not found in blood work. These include cancer, sleep-related conditions, mood or anxiety disorders, medication side effects, rarely heart, lung, or neurologic or autoimmune conditions that have not been diagnosed, and then the dreaded long COVID or post-COVID syndrome. I will leave a list of these conditions here, and my hope is that this can be a guide to your conversation with your doctor about what could potentially be driving your fatigue. The last thing I want to say is this. Fatigue might not be taken as seriously as a heart attack or a stroke, but in my eyes, I have a lot of empathy for patients that come and see me for fatigue. Our energy and our attention are all we have in life. It is the basic foundation of life itself. To be robbed of that is devastating. My hope is that this information reaches someone that can potentially get their energy back. I will see you on the next one.